health is a multi-faceted topic that we can really just go from different angles, and I hope that that's been very helpful to you. Now today, after I've done a series of metabolic health topics, today I'm going to focus on autoimmune conditions. And autoimmune is actually a very prevalent condition right now. We're talking about tens of millions of people in the US alone suffering from this. And it's also widely misunderstood. And so that's why I want to say it. That's why I want to pick this topic, and especially for women, because the sufferer, most women, majority of the autoimmune conditions happen to the women. Conventionally, or we all hear it all the time, if you are diagnosed with autoimmune conditions, they say, hey, we don't know why that happens. It's your immune system attacking itself, and you just have to manage it for the rest of your life. Okay, that's the conventional thinking. Now, if you're on the receiving end of this, it can be very scary, very, what's the word? Very disempowering, right? It could be very disappointing as well, because a lot of time people think, oh, for some reason my body betrayed me. And today, I'm going to provide you with a new perspective, give you a new lens, not to replace what you've been told or you've learned, but to expand it. And I want to, encourage you to look at the body very differently. So here's my question for you. Well, actually, we get past this. I forgot to flip this around. So this is the question. What about the body is never broken or making any mistake? What about the autoimmunity is actually your body's responding to something? Okay, and then I'm gonna dive into this. Before I start, I'm gonna share a personal story where this perspective comes from. My teacher, Carrie Dringwine, who is the founder of the Institute of Regenerative Health, she was diagnosed with 3 autoimmune conditions at age 30. She was diagnosed with early onset lupus, Hashimoto, which is the autoimmune condition on the thyroid gland, and then also fibromyalgia, which is the like a systemic pain in the body. She was also diagnosed with unexplained fertility and adrenal fatigue. Now, when she was diagnosed, she asked her doctor, and she was a dietitian back then. She was trained as a dietitian, and she said, none of what I learned helped. How did I even get to this state? And she asked her doctor, and the doctor said, well, we don't know, but if you take these medications, you're gonna live a relatively normal life, but shorter. And for her, she's like, this is not acceptable. And she has this inner knowing, somehow her body has shifted, and that she created this. And so she, at that moment, she decided, I'm gonna learn to heal myself and reverse it. She didn't know how, but she kind of had this inner healing, inner knowing that she would do it. So the next couple of years, she worked with naturopath, functional medicine doctor, hormone specialist, women health specialist, rheumatologist, and endocrinologist, all of that, and she was put in a lot of meds plus tons of supplements and spent tons of money. She said, she used the term, I use every dollar for my healing. And none of those moved the needle until she came across Dr. Robert Moore's regenerative detox work. Now, Dr. Morse is the founder of the International School of the Healing Arts, and his school focused on restoring the internal terrain at the cellular level. And they put a lot of focus on detox or what they call the regenerative detox. And that's what we call regenerative health today. So just from training and working with Dr. Morse, Carrie went into a very deep detox. And in 6 months, she reversed all her 3 autoimmune conditions, plus healed the infertility and the adrenal fatigue. She then had 2 healthy babies soon after that. And so that kind of gave her the framework and then also a new perspective on how to look at the body, how to approach healing. And after that, she opened a holistic clinic in Minneapolis. So the past 10-something years, 12 years, she's been helped thousands of people doing the same. Just reversing chronic conditions or reversing stage 4 cancers. Or even she helped a couple people who were sent to hospice and eventually walked out of hospice and still living 4 or 5 months after. So this is the power of regenerative health. And she knew that she has to really, get this out because a lot of people don't know about this, right? Why? I think she told us, she said, if this is so helpful and effective, why so little people know about it? Why the world didn't know about that? And so she made it her mission to spread the word out. So after the 10 plus years of clinical practice, during the COVID, when her clinic was deemed non-essential, she was forced to kind of go online and eventually open a school of herself, and that's Regenerative Health, Institute of Regenerative Health. So this is where I got trained from. I trained with Carrie Chiu directly, and then also this is deeply rooted in Dr. Robert Morse's regenerative detox philosophy. Now, Dr. Morse has been practicing for over 50 years. Her school is located in Florida, and he was known for reversing cancer, like stage 4 cancer, within like 56 days, 64 days, just really focus on deep detox. And so his work still continues, and now through the regenerative health practitioners worldwide, we are really expanding that circle of influence. And I just recently know that there's some kind of dark force trying to chase Carrie down, and there are people who try to really bring her down because her message is just, and some people don't want to see that, right? Okay, so what I'm going to share today, because of that, I'm going to tell you this is not in theory. This is all really just clinical observation that based on our training and then the real-world application. So we've seen this in the clinical experience, and then it's a repeated outcome that we see it not just once, twice, over and over and over again. It just works. It's a consistent patterns. So my mission here today is really, I try to put all the information together, from the very first workshop last spring to bring you this perspective of regenerative health and how the body really works, and so that you can really embark on your own healing with a very empowering mind. It's not just like, oh yeah, there's nothing I can do about it. We always have to source our health or healing from outside source. Mainly most people is their doctors, but indeed there's so many things that we can do on our own. Okay, so what is autoimmune? Let's go back to the basics. Now, conventional view, I mentioned, it thinks the body attacks itself, right? Or the immune system is confused. It doesn't know, it cannot tell between the self and non-self, and the reason is unknown. Okay, now regenerative health, we see body is very intelligent. The body doesn't make mistake. The body never make mistake. There's a reason it does certain things. There's a reason there's certain symptoms or responses. And so the symptoms, actually, it is a signal. It's a messenger that the body tries to tell you, hey, there's this system or this particular organ needs support. So we never look at the body as something outside of you. And then I think this is where I really bridge the unity principle to my line of work, because really, the body is the gateway and the vehicle, to our spiritual pursuit, right? So I keep repeating this theme, and that's the reason why, because if we cannot be in alignment with our physical body, it's really hard to advance in our spiritual pursuit. I'm not saying it's impossible, but if we can make the body and mind aligned with each other, everything is just easier, right? Okay, so the key reframing that I want to point out today is I would like you to invite you to shift from what is the body attacking, why is the body attacking itself, to what is the body responding to. Now, this I'm going to go back to that basics that I've been repeating throughout my workshop. This is a simplified view, but it's very helpful to help you understand how the body works. So we're basically trillion cells in two major fluids, right? We have blood, we have lymph. The blood feeds, the lymph cleanses. Now, the blood is usually take about 20% of the whole body fluid. I mean, we have other fluids, spinal fluid and all that, but I'm just talking about the main fluids. And the lymph is actually taking about 80%. But all the focus, it doesn't matter if conventional medicine or naturopath or functional medicine, most current medicine focus on the blood, but the lymph is ignored. But what we see now, pretty much across the board, is the majority of the modern diseases all lie in that lymphatic system because it's so congested. Okay. So when we move on, we have these two fluids. So just imagine that your blood is the kitchen that supplies all the nourishment to the body, and the lymph is your bathroom. It takes care of all the trash. So whatever we eat, drink, breathe, put on our skin, eventually get dumped into the lymphatic system if they don't serve us. Okay, so we have a lot of those toxins, not just from the food, from our thought too, from our environment. We also have 4 elimination pathways: our lungs, our kidneys, our colon, and the skin. Now, we often think the liver is considered a detox organ. It is, but in the sense that it processes all the chemicals and toxins. It's not elimination pathways. So all the toxin the liver processes eventually go through the bile and then into our gut, and then got carried out through the colon. So, but the liver is definitely a very important part in this whole system. So the real problem I mentioned earlier, mostly is because the lymphatic system is congested. Think about this: if you're in your home, if you have trash that you don't take out, a couple days probably will be fine. A week, you started seeing something, smell something. What about weeks? All the things just accumulated, right? And it's the same for our body. Every one of us need to eat and poop every day. Every single cell in our body needs to eat and poop every day. Okay, so if we were to look at metabolism, actually, you can eventually come down to 2 major things. One is the nourishment in, and then the garbage out, right? We want to have something in and something out. But what if we have more coming in than the body can eliminate? And that's where the problem comes, right? All the waste start accumulating. And when we in my line of work, we always say, what we don't eliminate, we accumulate. And that's what we see in pretty much everyone in our modern lifestyle. So I like to give this analogy. A healthy body is like a free-flowing river. But a congested body is like a stagnant swamp. And imagine, if this is a swamp, everything in it will start behaving differently, right? It will attract a lot of stuff in it. The water is stagnant. You smell something. The reason that initially people don't see the symptoms or cannot pinpoint the problem is because the lymph, well, the blood and lymph, they work together. So the body is very smart. Our blood has to stay at 7.4 pH. Okay, the bare minimum between 7.35 to 7.45. Outside of the range, we die, without exception. So what the body does is really, all day long, every minute, is try to buffer and compensate that pH. So say, for example, if we eat a piece of cake that kind of straw off the blood's pH, the body will try to compensate it. Or if we just have a big argument with our spouse, all the emotions come up that create an acidic reaction in the body will try to compensate. So everything we do, the blood will try to compensate until it cannot. Okay, but before all the symptoms showed up in the blood, it always, like I said, those emotions, arguments, or wrong food that eventually got dumped into the lymphatic system because the body cannot use it, right? And the lymph will just keep holding it until it cannot. And that's when you see the symptoms start showing. Because by the time you see, the number off in your lab work, that means the body has been compensating for quite some time. And they now find it spill over, and that's why they catch it in the blood. But before then, there's a long process of developing the symptoms. Now, as I mentioned earlier, conventional thinking think that the autoimmune cause is unknown. But if you dive deeper, as I was looking for the research, and you realize actually, even for mainstream medicine research, there's tons of study tell us a lot of things point to these patterns that we see in pretty much all the autoimmune conditions across the board. Okay, everything started with the digestive issue. It may be as small as like, oh, you're having some gas or bloating after eating, but then eventually progress into like, oh, there's some, you feel like your tummy is getting bigger, and as time goes, like some people wake up in the morning flat. By the end of the day, they're 3 months pregnant, 4 months pregnant, and that's very common in modern life. And that tells us because the microbe in the body is already off. That means you have more bad bacteria than the good ones, okay? Now, if this continues to progress, then you will become what we call the leaky gut. Leaky gut is basically the gut lining. Usually, it only allows usable things. We have those tiny villi along the gut lining. It will allow the food that's properly digested into a properly sized to get into the body so the body can use it. But if you have leaky gut, means those gut lining have some holes on it. Okay, it's a bigger holes. Those bigger holes will allow food that are not properly broken down to get through the other side of your gut lining, which is 80% of your immune cells live. And so leaky gut is pretty well established medical fact now, is the precursor for all the autoimmune conditions. And it's not just autoimmune, actually. What we see really is leaky gut is for everything, every chronic disease that we've seen under the sun these days. The other thing is the toxin overload. Just imagine living in the modern life. We got so much convenience in our life. in exchange for all the problems that eventually accumulate in our body, okay? I'm not just talking about toxin from the food, I mean from the air, from the water, even from our clothing, right? Have you noticed it's hard to find a clothing without the elastic?
Yeah.
Because it's hard to find 100% cotton or linen these days. And those, as long as they're not 100% cotton or linen, there's plastic in it. All the, what do you call that, spandex, nylon, yeah, they're all plastic. So we all are inundated with that. And I'm saying this not to scare you, but to encourage you to be aware so that you know there are things we can do to reduce that. Diet is another issue, and then that's not just, not just personal choices. It's actually also related to how depleted our soils are. I mean, we cannot find minerals or micronutrients in the modern soil compared to like soil in our grandmother's time. And so even the organic foods from the market these days, they're void of the essential micronutrients, and that's kind of a sad reality for us. Now, the other thing I want to talk about, molecular mimicry. This is a term to describe that something foreign to the body get into the body, but with the disguise. And so when the immune system tries to respond to this thing that's similar to the cells, and sometimes it misfires. So it tried to tackle this. But because they look so much alike from our own cells, and sometimes the immune system just pretty much take both. Or in that process of responding to this foreign stuff, it misfires. Kind of a collateral damage, if you will. Now, stress, emotion, and trauma, that's a big one. Okay, Jana know about that. We all stress. Every single one of us is stressed.
Is this where cortisol comes in?
Yes. So
I've been reading about that lately.
yes. So the cortisol is our stress hormone, right? Cortisol is not a bad thing. When cortisol is released, the body will have that anti-inflammatory effect. So cortisol itself is an anti-inflammatory hormone. But when that stress becomes chronic over time, now that your body's been swimming in the sea of cortisol, that becomes a chronic inflammation because that will wear out your adrenal glands. And then now adrenal no longer have that capacity to calm down that inflammation. So that's when the problem starts. Otherwise, cortisol itself is not an issue if it's at the right amount, at the right time, right? I mean, there's no way we can avoid stress in our life. But over time, stress is another story. The other thing I want to talk about, chronic infection, well, I would dive into it a little bit deeper, but just know that we all, most of the people are dealing with those chronic infections in the body without even knowing it. So because of all those factors that we see earlier, this is the result. We have nutrient deficiency, we have toxin overload, and the toxin overload resulted in lymphatic congestion, as I told you earlier. Now, how do you know your lymphatic system is congested? I would like you to do this test at home. First thing in the morning, after you wake up, pee into a jar, and then let your pee sit for half day, 4-8 hours, or even up to 24 hours. See if you see any flakes or sediment in it, or cloudiness. Okay, if your pee is clear, that means your kidneys are not filtering out the lymphatic waste. Now, this is unheard of, I know, for most people, or in conventional sense, because we are told that we're not supposed to see anything in our urine, otherwise it's an indication of infection, which is true. When we are infected, the body will try to get the infection out as much as possible, so it will push out stuff, okay? But we're supposed to see the sediment even when we are not infected, okay?
So we're looking for sediment?
You're looking for sediment or flakes, cloudiness in your urine.
And that's good.
That's a good thing. If you don't see it, that means the lymphatic system is congested. Because why? The lymphatic waste are excreted mostly through kidney as a form of urine. If you don't see anything in your urine, that means where did all the lymphatic waste go? It's still in your body. And that's what I'm talking about, why everyone's lymphatic system is so congested. But why the kidneys cannot do the proper job to filter it out? Again, then we go back to the modern lifestyle, because there's so much stress. Everyone's kidneys are weakened. And then we see that in a generation after generation, our gene become weaker, and so as our kidneys. But we can reverse it. That's the part that I will share with you. So if you have those issues, nutrient deficiency, toxin overload, you will end up having a distorted or lost cellular communications. And that's a very important part. Because without that communication between the cell properly, sometimes cells just behave bizarre or not in the right direction, or even completely lost the communication. And so if you understand all up to this point, you probably will understand what the epigenetics is trying to tell us. Epigenetics is the study of the environment that's surrounding the cells. And then this is a science now showed us that the most important factor that affects how our cells behave is the environment that the cells are in, not what's inside that cell. Okay, this is a very interesting part. And that's why, we always hear this phrase in my line of work. We say gene loads the gun, environment pulls the trigger. So people used to think that genetics is deterministic. Oh, my dad or my mom has hyperpressure, or type 2 diabetes, so I'm destined to have it. But we see now that no, it's not that case at all. 95% of the chronic diseases has nothing to do with your gene, even if you are carrying that particular gene that make you susceptible to that condition. It requires environmental trigger to turn on that gene. And if you can turn on that gene, you can turn off that gene. So that's the part that I would like you to I would like to invite you to understand and remember. Now, this is the part I mentioned earlier. I would like to spend a little bit of time, the biological stressors about the chronic infection in our body. This is often the part that's not talked about, even in natural medicine, functional medicine, not to mention conventional medicine. What we see is, just again, go back to the nature. Our body is nature. When you see a swampy environment, all the things gonna grow in there. All the nasty things gonna grow in there, right? It's the same in our body. Okay, if you have a very congested system, you have a lot of damaged cells, dying cells, toxins. The microbe would thrive. On top of that, pretty much everyone, at least everyone that I worked with so far, or everyone I know of, most of the people I know of in my life, are dealing with digestive issues. So that means, and for us who are 40, 50 years old, we all kind of have an underproductive stomach acid. So that means that very healthy salad that we eat may not be breaking down properly, or because the stomach acid is not strong enough to kill the microbe in that salad. Okay, so we will see these microbes become a very opportunistic to get into our body. Parasite, I want to talk about it a little bit, because most people think, especially in the Western world, I hope this is not too heavy, but I want to say this in a more grounding way, not in a way to give you fear, but in a way to help you understand human physiology so that you know how to deal with it, how to look at it, and there's anything that you can do. When people hear me talk about parasite, my clients, every single one of them, they say, no, we are the first world country. We're first world country. We don't have parasites here. And I want to say this is, what we see is probably American population is most parasitic loaded population in the world because of the chronic conditions that we're facing. Okay, and again, it's because a compromised internal environment, a compromised terrain. Okay, and then again, we want to go back to the nature. I keep referring to the nature so you understand why. If you look at the nature, you see a roadkill. You would also expect to see some parasites acting upon those dead flesh, right? And then after a few days, those dead flesh got broken down and then returned to the ground and become part of nature. The same thing happened in our human body. So if we have those damaged cells and dying cells, yet the body doesn't have the capacity to eliminate it, eventually the body has to deal with it somehow. So the body will recruit microbes to do their job. So the microbes are there actually to help clean up that which no longer serves us, which is a good thing. The problem is because the environment hasn't changed, and so the microbes just keep coming. They won't stop coming. We want them to finish the job and leave, but they don't. They stay there because that environment, there's more stuff coming in for them to clean up. That's why we see such a big deal now in the healing world, natural healing world. And we see this in pretty much across the board of all autoimmune conditions that we work with. And why we know that, if you ask me to present you with scientific proof, I cannot. But I can tell you is what we see clinically is whenever we deworm people, we detox them, their autoimmunity goes away, just simply disappear. And so do you think it's the immune system misfire, immune system attack itself? No. That's why we have that conclusion. No, the body's never made a mistake. There's a reason for it to respond or behave that way. So the body is actively responding. It's not confused, okay? It's never, like I said, it doesn't make a mistake. If it's a foreign object in the body, the immune system is going to respond. So this is again what we see. When we work with people with autoimmune conditions, we need to deworm them. We need to get the heavy metal out of their body, because this is a chain reaction. Okay, first of all, the microbes are there because the environment is compromised. And then the microbes are there also because there's heavy metal in it. And there's studies show that the microbe, when they study those worms in the body, they found that the worms are packed with heavy metal. So again, it's the what's the word? 清道夫.
Toxins?
No, the person who clean up the job.
The garbage man?
Okay, yeah, garbage bin, that will work.
Endocrinologist,
No, I'm talking about
like a scavenger?
scavenger, yes. It's a scavenger kind of thing that they're there to clean up the mass in the terrain, to clean up eat up the heavy metal in the body. And that's why we always say, where heavy metal goes, parasites flows. Now we have all these kind of jargon in our life of work to help educate people. So far so good, you follow?
Yes.
Okay? And so again, we go back to that question. The immune system is not attacking itself or is not fighting against self. It is fighting against the intruders that take over the cells. that's talked about Western medicine approach for a little bit, because this is where I think it creates a big problem right now. We all know that all the pharmaceutical drugs is basically to suppress the symptoms, right? It's like your kitchen is on fire. Instead of putting that fire off, you turn off the alarm. That's what the pharmaceutical drug do. And so what we see very commonly now is that once people are diagnosed with one autoimmune conditions, if they don't do anything, they just follow the conventional route to take meds, they will soon be diagnosed with the second, third, or even fourth one. I met this girl who was in her early 30s in a local networking group. She was diagnosed with 5 autoimmune conditions within 3 years. It is so sad, you know. But this we see a lot, and that's why people, my clients, for example, they rarely only dealing with one autoimmune. There are always a couple ones. Okay, I'm going to give you some examples. I'm going to talk about the thyroid. I don't know if we hear anybody. We can skip. You do?
I'm right on the edge.
Okay, I'll have 3 examples because there's so many, I mean, over 100 autoimmune types now. But I'm going to talk about 3 most common ones. One is the thyroid. The other one is arthritis, or RA, and then MS. I'm going to touch on these 3. So the thyroid is the most common autoimmune condition for women. I mean, 1 in 8, like 20 million of American women. It's insane. And I work with quite a few of them.
And men.
And men too, yes. Yes. But mostly it happens I think 80% is women, poor women. And the reason we need to learn about this, because thyroid really is the master gland in our metabolism. It controls so many functions in our body, right? Metabolism, energy, weight, body temperature, hormones. Now, there are different types of thyroid conditions. You can see those first 2 is just what we call the regular thyroid issue. Usually it happens, the issue is more on the thyroid gland. Well, not even on the thyroid gland itself, but it's not involved with immune system. The other 2 is immune induced. Okay, Hashimoto is a very common one. It's the autoimmune version of the hypothyroidism. And then Graves is the hyper side of the spectrum. The symptoms, a lot of people experience this common pattern: fatigue, weight changes, hair loss, eyebrow thinning, dry skin, brain fog, hormonal imbalance, depression, anxiety. Okay, this is all what I see when people say, hey, I want to come, I want to fix my thyroid issue, and they're already dealing with all these. It's never just one thing. Now, although most people only focus on the thyroid gland itself, what we see, this is important to understand, because the thyroid, it doesn't just work on its own. There's a chain of communication going on. So this is the chain, the hierarchy of the chain. Let's go back to the gut. Gut is the entry point for pretty much everything. Now, you probably heard me talk about this a few times in the past workshop. There's a gut-brain connection, okay? The communication between the 2, 9 out of 10 is from the gut to the brain. Only 1 coming down from the brain to the gut. So gut is the real boss. And so you can see this chain when the body needs hormones, particular thyroid hormones, the gut tells the brain, which is hypothalamus, then hypothalamus tells the pituitary, hey, thyroid, make some thyroid hormone. Okay, then your thyroid hormones are, yes, boss, which one? Is it T3, T4, or TSH, right? And then if the thyroid responds correctly, we say this is a healthy balance. system. What we see most likely is somewhere in that communication chain is lost or distorted. Okay, so that's why we see the majority of the cases where they're taking thyroid meds. They don't need thyroid meds at all, because that's not the problem. The problem is upstreams. It's either your pituitary, mostly what we see pituitary, or the liver is not converting that T3 raw material, that T4 raw material into a T3, which is usable to the body. Okay, so, well. So the thyroid, yeah, thyroid is the end point, not the starting point. Again, these are the patterns. And probably, can you relate, Phyllis? Yeah? Okay.
That damn sugar.
Well, sugar is in the dietary part, yes. And I want to talk about sugar, the craving, because a lot of time it's not about willpower. Because when your terrain is off, there's so many forces ask you for that piece of cake. It's not all your fault, okay? Because you're, I mean, at the beginning, yes, you can always say, yeah, we can do better, but then after you pass a certain point, it's no longer in your control. Because the microbes, the parasite, that's what we see the most, okay? Or the environment is not right anymore, and those microbes, especially parasites, can really hijack your thoughts, hijack your hormone. So they're powerful stuff. Okay, this is another aspect is connected to the thyroid, is the nutrition part. But I'm not just concerned about not getting enough. The biggest part is not absorbing it, even if people are eating the right thing. Because again, it's that compromised gut issue that everyone is dealing with. Okay, and if you're not eating 100% organic food, you will have leaky gut because of the glyphosate, which is the main ingredient in Roundup. And the study shows once your gut is exposed to glyphosate, within just 30 seconds or something, it punches a hole in your gut lining. And even if you're eating 100% organic, you will still get it because it's in the air, in the water. It's just everywhere. It's just ridiculous. But I'm going to share how to deal with it later, so don't worry. This is something that I see a lot, and in my practice, we do this because I realize that people can get well already, start feeling better with the diet change and lifestyle changes, but a lot of time because all the things are already in the system, and if you don't remove them, it's hard for the gut to start absorbing foods or nutrients or all the food that you're eating, the good food that you're eating. And so oftentimes we have to really remove this to help people move the needle. These are the thing that build up on your gut lining. It's like imagine your kitchen pipe. Every once in a while we need to pull down something to dissolve all those build up. And the kind of same with our human body. And most of us, we don't do it, for the entire life. I remember when I was going through this myself, you see I don't have extra gut. I think I released at least 2-3 pounds of those. It's eye-opening.
I have a question.
Yes?
Well, when I get a colonoscopy
Yeah.
every 10 years, and the inside, when I get a colonoscopy, the inside of my gut looks pink and fine.
Mm-hmm.
But the stuff that comes out is hiding inside of that?
Yeah, it's in the small intestine and large intestine. So usually you can really do it, even with the superfood that a few of you have tried. It doesn't really get rid of that mucus plaque. It will thin it to some degree, but this really requires some superpower I use a whole food enzymatic enzyme that's fermented for 3 years, and you just drink the enzyme all day, and then the next day you just poop out all those. And every single client was like, oh my God, this is coming out of me? Yeah. And like I said, even me living in a very healthy lifestyle, and I just like, I cannot believe what I see. And oftentimes, like I said, when people are already struggling for a long time, and this, will be a necessary step in order to move the needle, to do the work later. Not everyone is ready for it, because we need to bring back the energy and prepare the body to some degree before we can do that, before we can move forward. Okay, next one I'm going to talk about arthritis. This is a very common one for elder people as well, or even not too old people. Like these days, I have like a 30 years old, 40 years old complaining about arthritis pain. It affects so many people, 50 million there. Joint pain, stiffness, chronic aches. Again, you were told it's aging, it's genetic, just manage for life. What if it's not the full picture? Why the inflammation is there in the first place? That's the puzzle we try to solve. The different kinds of arthritis, as you can see, there quite a few are involved with the autoimmune, the immune system. Rheumatoid, RA is the most common one. There's psoriatic arthritis. There's lupus, fibromyalgia. Those are pretty much under the one big umbrella that we don't really separate them because they are coming from the same underlying pattern and terrain. Okay, so same root, different expression. Okay, all those usual suspects. Toxic buildup, poor elimination, inflammation, microbial, immune system activates. Okay, rheumatoid arthritis is basically the immune system, again, conventional thinking, the immune system attack your joint, but by now there's a reason why the immune system is going after it, because there's something there for them to respond to. I want to talk, I actually talked about this earlier, adrenal's role, and when your adrenal is weakened, it's hard to calm that inflammation down. Fibromyalgia, it's very, very common, and in Western medicine, when basically the doctors don't know what's going on, when they cannot give you a definite diagnosis, they will say, oh, you have fibromyalgia. Okay, that means just pain over the body, okay, inflammation over the body. And this one I want to mention that it's considered the most emotionally involved condition. So there's always, every single physical problem can be traced back to the emotional imbalance. That's for sure. But in fibromyalgia, it's being considered the most involved with the emotions. So that's something to think about. So what I see now, I haven't worked with enough arthritis people, but I do have a few of them, and what we see is once we start changing the terrain, their body responds so fast. That's the important part I would like you to know, because you can see their pain just reduce in just a week or two. It's so fast. Now, if you want to completely reverse it, of course, it takes a little bit more time. And it also depends on how long you've been on the medication. The longer you are on the pharmaceutical drug, it would take longer for your body to reverse it. But it's very possible, and we see this, plenty. I want to talk about MS, and Matt is here. Please give us feedback or correct me anytime if you think or you have new thought, please share with us. Yeah, but this is what we see. Again, this is the immune system, right? Attacking your own body, specifically on the myelin sheath. Now, myelin sheath is, think about it as a kind of a protective rubbery insulation around the wire. And that wire in your body is the long tail of that neuron. Okay, and what it does is really help facilitate the communication among the the neurons. So what we see is that the myelin sheath has been attacked or therefore damaged by the immune system. But what if it's not? And I want to show you some interesting different perspective. This is a work by Dr. Adam McDonald, who passed away, who was a pathologist. And he found, through the autopsy of MS patients, that he found every single case that he studied parasites, the larvae, eggs, or even adult parasites in their spinal fluid and in the tissue. And that's why he raised a question. And because those biological material that's found in the central nervous system was not detected through regular pathological exam. No. Dr. McDonald developed a very specific way or method to examine it in a very detailed way. I cannot explain to you, but you can Google it. But basically, that's what he finds. And so he challenged the conventional idea that it's the immune system misfire or mistakenly taking it. Because again, there's a foreign object or substance in the spinal fluid, in the central nervous system. That's why the immune system responded to it, right? But of course, his study is kind of relatively very small, and this is not fully accepted by mainstream medicine, of course, as you can imagine. But just knowing that these cases were all examined conventionally by other pathologists using a standard procedure, but they didn't find anything, and the fact that he found them. And I can show you. It's interesting. This is one of his presentations. You can look at them online. What he see under a very specially made microbe. The right one is the adult parasites, and then the left one, I don't know, is it worms, eggs, or larvae? Anyway. So the reason he questioned that is usually in our spinal fluid, it's a very, very extreme, clean environment, almost sterile. So nothing should have been there. But the fact that something got into there, that means there's foreign object there, and that's why the immune system came in, moved in, and responded to it. Now, the other thing he pointed out is that the MS system usually appear in different parts of the body over time, and so he argued that that kind of mirroring the moving object through the tissue and how they behave. So if it's mobile parasites or something, there's bacteria too. He found bacteria too. That kind of mirroring the pattern of it. So that's what his conclusion is. In my perspective, or in regenerative health, we never single out any one single cause. So even that's one aspect and could be very useful and valid. We don't see it as a one single cause, the cause that MS. Again, it's a whole myriad of things, the entire terrain, and parasites are only part of it. Okay, as a result, not the root cause. You want to share anything with us?
No, you brought up something very important and something that when we think about it, it's that cellular mimicry that you talked about earlier, but the EBV had come in. We all have EBV, I'll let you know. And so we triggered that especially at one point based on, stress, pharmaceutical, weakening the immune system or whatever it was in there. Then EBV took over, and then EBV went into the actual brain itself, broke that blood-brain barrier, and then actually got into the spinal fluid as well and started going. So that's very interesting. And definitely when you take a look at heavy metals is something that is fed by all those parasites that actually exist in all of our bodies as well. So it's that ability to get on top of that. and begin reversing that. But also you had talked about the environment, stress, worries, doubts, shames, fears, really is one of those that really sparks a lot of it. I know for myself,
Yeah.
you want to take out walking from me, just get me stressed out. Going through a lot of stress, like I went through in December, basically my walking, I was 800 steps a day. I was not doing well. Now I'm up to 3,000 because I'm taking care of my body a little bit better. But this, I got some more work to do.
Yeah. Well, I mean, I'm sure we all can relate. I mean, we have those days we simply don't want to do anything. We're just gonna blah, right? We all have that. But it also, as Matt just shared, even just the little things that you start doing or resume doing, you feel difference already. And that's why we often say sometimes it's not about making the big changes. It's just the little things, getting enough sunlight, move your body a bit more, ground yourself every day. Those things, or go to bed earlier, cut down the screen time, those all add up and create a positive influence in the body. But there are, like I said, I'm talking about most people already past a certain point, they probably need extra support other than just that. But start doing that, those little things alone can contribute a lot in the towards the positive change. Okay, so here is kind of my final thoughts. You've been hearing about this a few times now with different examples. This is what we see in our conclusion. Autoimmune is not the immune system making mistake. Okay, it's responding to it. And then there's the same, pretty much every single autoimmune that we see has share the same pattern, terrain pattern, and that's why the way the line of my work, it can apply to anything. It doesn't matter which autoimmune you're dealing with or which chronic condition you're dealing with, because we take care of the roots, okay? And then I was talking to Matt earlier, there's always emotional and spiritual part involved. And I focus on physical body is because most people, again, are already dealing with so much physical struggles. And until we bring them up to a certain level in terms of their energy, reduce their pain, it's hard for them to just keep the positive mindset and then only, work on the mind in order to heal themselves. And even better, actually, you should go mind and body together. That's the ideal. But what I see in my practice is really, if someone is not sleeping, someone is having pain all day long, it's hard to put them or bring them into doing the inner work yet. And so we always stabilize their physical condition first. And then like half into the program, we start, now they have energy, they have a more positive mindset about it, and then we can talk about more from there. But I totally believe that, emotional healing and then the spirituality, especially what we learn in Unity, can really help facilitate that healing, big time. Okay, so here's the conclusion. Autoimmune is not random, it's not self-attack, and it's not permanent. Everyone can reverse it, okay? It's a response, survival mechanism, and it's the body sending signals that, hey, I need some support here, Okay, Sab, can you play that short video for me? It's only like a 1 minute, one and a half minutes, about this person who's reversing.
I have successfully reversed hypothyroidism and Hashimoto's in my body 100% holistically. When I was diagnosed back in 2014, I was told that I would need to be on medications for the rest of my life. And most likely the medications would need to be increased over time. And what ended up happening was, because it didn't feel any better being on the medication, I decided that I really wanted to focus my efforts and my energies on figuring out how to get myself healthy. And that is exactly what I've done. I went on a protocol that addressed diet, gut health, parasites, chemicals, heavy metals in my body. And within a period of 6 months, I had not only reversed most of the chronic issues that I was feeling, depression, gut issues, weight, a lot of chronic aches and pains and brain fog. Not only did I reverse all of those symptoms, but I was able to get off thyroid medication, something that I was told by multiple doctors and many, many people that I would be on for the rest of my life. So it goes to show that the body is self-healing, and it really is a matter of properly supporting your body through nutrition, through lifestyle changes, as well as detoxification.
We have a couple last, okay. Yes, so that's one of the practitioners. I mean, she became, it's interesting, this line of work that I'm doing has inspired so many people from their own healing, and then they become practitioners. I have clients who is becoming a practitioner because he has healed from working with me, and then he helped his wife and the family, and he was so inspired by his own journey. Okay. Okay, so this is my own experience. I mentioned earlier, I have a few RA and arthritis clients, and they, I wouldn't say that I help them reverse, because these people, they stop at 3 months, and they feel so much better. They feel like I'm all good. I don't need to work harder. But I know that there are room for them to go into it, and if they want to reverse their diagnosis completely. Like Julie that you saw earlier, she's been on all the meds for 6 years without anything. Carrie, my teacher, she was med-free for 12 years, and they just never come back. Those autoimmune conditions never come back. I also help type 1 diabetes and type 1.5. Those are autoimmune conditions that I've worked with. We see how even the type 1 people, they can dramatically reduce their insulin dose. Okay, so this is very possible, and it's doable. It's doable. The principle is simple, but it's not easy because it takes commitment. It takes commitment. And oftentimes, the clients has to be the active participant in their own healing, because this is very different from going to a doctor and you just leave everything to your doctor. You were waiting to be fixed. This is very different. And so sometimes this can be a little bit challenging for some people who are not ready, So these cases, they're not even in full protocol yet. And they already see dramatic change in their body. All right, so that's the presentation today. And do you have any questions that we can talk about?
So wonderful and clear.
You feel clear?
So much information.
Yeah. I hope that this helps. And then this is probably the last one that I would do until further notice. I'm moving out in June to Atlanta. Georgia, outside of Atlanta. I'll be still back and forth. Still back and forth, but I don't know when will be the next workshop.
Yeah. Thank you personally.
As
Miss
well as
you.
this.
Thank you. So those handouts that I give you, I want you to see this.
I didn't,
Okay.
should you still be on the microphone? Oh, I didn't.
Yes. So this handout, particularly level detoxification, you can see water fasting is the highest level, right? Because that's the most challenging one, and most people cannot do it. And I want to be encouraging and empowering you. Most of my clients, they are on level 2. They're already seeing huge, huge healing and improvement. They're on level 2. They're not even on 100% raw food or vegetables. On level 2, well, of course, I want them to be at a certain percentage of raw food so that they get better result. But I'm just telling you, the body is constantly repairing and regenerating if it's given the opportunity. And so once you give it the right resource, right material, it will start repairing no matter what. So it doesn't have to be all or none. I know often in detox world, people will say, hey, you have to 100% fruit, 100% fruit juice, whatever. That's all great. If people are ready and want to deep dive into it or reverse their chronic conditions fast, definitely there's a way to do it. But most people, I just meet people where they are, and most likely, we start with just going for the whole food, and then gradually increase your percentage of raw food, and then even fruits. And then fruits, I want to tell you, because I think I mentioned this a few times, fruits are the best lymphatic cleansers. So don't be afraid of fruits. I know we all been told the fruits will spike your blood sugar and all that, and that's because the liver is already so clogged up. Okay, not because the fruit is the scapegoat. I mentioned about this in our workshop back in I don't know when I talked about the blood sugar and diabetes. But yeah, don't be afraid of fruit, but you have to pay attention to the timing and the combination of how you eat fruits. So always eat your fruits alone. Just remember this, fruits alone or leave them alone. Okay, because you don't want the fruit to sit behind a heavy meal, because fruit digests the fastest, and it also uses different enzyme. So when you have fruits following the big meal, that fruit just sit on top of the heavy meal and start fermenting, and that's when you start having that gurgling noise, bloating, gassy, belching sensation. Okay, so make sure you eat them alone. Don't combine it with other food. Okay, the other thing is, now the weather is warmer, you are welcome to incorporate more fruit in the first part of your day, because our body oftentimes, or not often, always detox when we're asleep. And so in the morning, you've already have all those stuff gone out, pushed out, ready to be eliminated. So if you have fruits in the morning, that would kind of facilitate that process. Green juice is a good way too, especially for people dealing with adrenal issues. If you are already dealing with chronic fatigue, or you feel like if you don't eat enough food, you will have like a shaky hand. That means your adrenal are really struggling a bit. And then I would encourage you to not only just eat fruit, but also add the green juice to it, because the green juice is where all the minerals come from. It will stabilize, help your nervous system. Adrenal issue mostly is from the nervous system. Okay, other than that, those are little tips. The other two handout, really, this is something that you can do at home. And I would say that there's so much to navigate in terms of reversing the chronic conditions. If you can do anything here, anything would help. But if you want to really reverse it in an efficient time, I would encourage you to work with someone professional and who is experienced, because it's so many pieces to navigate. But there's something for you to learn, and that you can incorporate into your everyday diet or lifestyle. All right, any final thoughts, questions? Yes.
Sorry. At the bottom of this parasite sheet, it says when killing parasites, don't forget to use a binder.
Yes.
What's that?
Okay, so binder is something that carry the toxins or parasite out of your body. So when we are dealing with a parasite, and when parasite dies, it will release tons of toxins. And one of the things that parasite does, they're very clever. They would try to make you like constipated, for example, because they try to hold on to their territory. They would make you not to go, or your digestion will just slow down, or if your elimination pathway, like I said, the kidney are not filtering, not opening up, or you are not pooping regularly, then those dead parasites could be recirculating in your body. And so we want something extra to help the body to push them out. So the binders could be like chlorella, diatomaceous herb, or in my practice, I use quite a few of them. It depends on the client's budget or lifestyle or accessibility. But there are common things like chlorella, like blue algae. They're very cheap and very accessible. You can use those. So we don't want, the reason you want to use binder is because after you kill, you want to make sure they're out. If they don't, then you really just recirculate them, and it also make you very sick too. It can make you sick. Yeah, because they are originally all hidden, and now you pull them out, and they're over in your body. Again, the toxin they release before they die can really just wreak havoc on the nervous system.
So you want to do these together with these?
The binder, yeah. If you do, well, I would say, if you follow a intense parasite protocol, you definitely want to have some binder. But if you just pick one thing or two things, include in your everyday diet, it probably won't matter because it's probably hard for you to get rid of parasite that way. I've seen interesting, every client, they would say, no, I don't have parasite. I don't think I have it. Until they see it. And oftentimes it's involved with digging around, poking around the poop to find it. But 70% of the parasite, we cannot see it with our bare eyes. But I do have people poop out like 1 foot long, 2 foot long. I have all the pictures. A fun part of my work is seeing all the pictures the clients sent me, their mucoid plaque, their poop, their parasites. Yeah, I have clients just vomit out parasites too. So, but those are stronger protocol. And the one that you've tried, those Peilin, they're very gentle, and they would bring down the population of the parasite. The small ones, yeah, but the big one usually it requires stronger protocol to do it. Yep.
So can you combine these chelators, like in a smoothie of a morning, if I put parsley and chlorella in it?
Yes, if it's from the foods, it's fine.
Mm-hmm. Okay.
Yeah. But if they're specifically formulated in some way, then you might want to be cautious because sometimes they can be very powerful. They can be powerful, but as long as, like I said, just keep your elimination pathway open. Make sure before you do any parasite cleanse, you make sure you have a good bowel movement. Yep. Do you have any experience to share with us in your community, the MS community, how you deal with this?
Oh, I can tell you the day it began. So I can tell you the day that MS started, specifically. It was in March of 2013, over 16 years ago, or 13 years ago, let me do math. I was under a heavy amount of stress. My diet was not very good. I was stressing the body with exercise a lot. I was doing CrossFit. And also at that time I had a bad injury, so they put me on 3 months of antibiotic usage. So I stripped all my gut microbiome down, and on the last one I experienced 25 to 30 strokes a day for 4 months. Yeah. And so that was the start of it. I remember going blind. That was scary. Then as I started to pull all of this stuff, I was diagnosed in 2017. Was told at that time I was 4 months or 6 months from a wheelchair because of the severity of the MS that the neurologist had found. And I told her no. And she wanted to put me on medication, and I said no. So that's when I went the naturopathic route, and I started to meet with somebody to actually remove the parasites out of my body and do all of those pieces. That was one of them. But then with the work I do, I work on the mind. Is really bringing that mind back into balance, believing that you know that you can, you'll start to develop different habits to actually create it. So with all of it, that's been my experience. It is still an ongoing experience, but I'm always looking at the next piece that tips it over.
Yeah.
And even for
I love it, and I love your share, because I think mindset really is everything in this work. Really. A big part of my program, coaching, is actually all about mindset. That mindset affects every decision that we make every single day, either we know it or not knowing it, right? So I have someone, well, I don't want to say about that, but yeah, what I just try to say is sometimes you can't really help people when they're not ready, when the mindset is not there. It doesn't matter how much you try to help them, but they're not ready. That means their mindset is not there. It's not going to work. Yep, it's not going to work, and definitely. And I think I really appreciate what we do at Unity, because the Unity principle and the teaching really help facilitate everything that we do on the physical level. That is for sure. That's for sure. Yeah. Although it may come, it could be in different order for everyone. Some people can immediately jump into the mind work and get huge healing out of it, which is great. And I mean, that just tells us how our body can heal in so many different ways and so many different angles. But like I said, most of the work that I do, because people are already struggling for a long time, and we really need to stabilize the physical body first before we move on to a deeper work.
Thank you.
Any question?
Thank you.
You're very welcome. Thank you. Thank you, Seb.